Hello, and thanks everybody for joining. Hopefully you're all having a good Friday and looking forward to the weekend. My name is Jody Rodney. I'm the Vice President of Marketing and Education for Plan Mecca USA. I think we're on our 13th or 14th Digital Mastery Series webinar. And with us today is Cindy Purdy, and her topic is Teledentistry, using technology to continue care in your community. Before we get started, I do have a few housekeeping items. I want to make sure that everybody is clear because we get a lot of questions on the CE survey. First and foremost, the CE survey link will be posted in the chat at the end during the Q&A function. During the Q&A portion. And then we will also send a follow-up email to you, hopefully later today, with a recording of the webinar as well as a link to the CE survey. Please note that everybody is muted and you're not on video. So if you are lounging and drinking coffee in your PJs, that's totally fine. Enjoy yourself. Again, if you have questions for Cindy, please submit those via the Q&A. It's much easier for us to track them and navigate through them if they're in the Q&A and not the chat. Cindy's presentation will take about 1 hour and 40 minutes. This is a 2 CE hour credit, so it's a little bit longer than some of our others. We will leave about 20 minutes for Q&A at the end. So without further ado, I'd like to introduce Cindy. Thank you.
Hello, everybody. I really want to thank you for giving me your Friday. I hope you all aren't all webinared out at this time, because I do have some information to share with you that I'm hoping will help get you through this interim period with COVID, and then after you get back into your norm, whatever our norm is going to be. So I'm not going to really ask you. I'm going to ask you guys to think past where you're normally practicing. I'm not really going to ask you to get out of the box. I'm just going to ask you to kind of push on the walls of your box and maybe think about things a little differently. You're welcome to take any screenshots of my slides that you want to. They are copyrighted, but only because they're totally okay for informational purposes. I just don't care to see them and show up in another presentation. But I chose a very bright theme for all of us because I'm from Colorado. I don't know about y'all, but I am ready for winter to be over. I'm ready for spring. I want to see bumblebees flying, honeybees flying around. So I'm hoping this will push us all through and we can all get some new information here. So I don't know, what do y'all think? Y'all feel like you're in the twilight zone here? You think, I just can't believe the things that are happening to all of us right now. As of 6 or 8 weeks ago, this was not the world that I lived in, and I know it wasn't the world that you all lived in. Teledentistry had almost, to me, reached its peak. We had just had a great first annual meeting for the National Mobile Dental Association. It was in Orlando in February. End of February, it sold out twice. They kept making it bigger and it kept selling out. People were charged. They were ready to go with teledentistry, whether it be individual or be working with their dentist, to be moving out, reaching out into the community. And at that same time, this American Mobile Dentistry Alliance was formed for the first time ever. We were all organized and ready to go. And then this little thing came along, right? Kind of messed up everybody's lives and worlds. Before we move on, I do want to say that I'm very thankful for this course. It's granted to us by Plan Mecca through an educational grant. My other topic that I speak on is ergonomics. So I have used LM Dental's non-sharpening instruments for many years, have recommended them for many years. So very pleased when a company that I like, that I support, is helping to support the rest of us in our world too. So very, very grateful for that. I'll tell you a little bit about myself, not that this is at all about myself, but I'm going to give some disclosures that I do work for different companies in addition to being a practicing dentist. This is my 2020 as a practicing dental hygienist, but I have other companies. I've either consulted with them or I'm their employee. I am the employee of dental works, also you all know where head is coming. And most of that is because of my ergonomic presentations, actually. So here are the objectives. Here are what we're going to try to talk about. But a lot of people who don't understand it, and it's very different.
Hi all, we are experiencing some technical difficulties. It seems like it might be an audio or connection issue on Cindy's end. Just hang tight and we will see if we can try and fix it. Hang tight.
Can you hear me?
Yes.
Okay.
It's a little spotty and then
it unmuted me.
Yep, Cindy, so your connection seems to be really spotty. It was going in and out before your slides went down.
Oh, I'm sorry.
That's all right. I don't know if there's a better area within the house, potentially.
I can move real quick.
All right. Hang tight, guys. We're gonna pivot. This is the fun challenge of webinars these day and age. So thank you all for being patient. All right, Cindy, when you get your slides loaded, do you maybe want to go off of video too, just to help with your connection?
Okay. Go to screen share. So sorry about this. No matter how many times you try it, right?
Yep.
Should I
Yes,
start
go
over? Was
Yeah,
it from the very
go,
beginning?
yeah, go ahead and go after your Twilight Zone. It seemed to be a couple slides in. And then if you can stop doing your video, that might help with the connection.
Okay.
Folks are making some very nice comments that they don't have anywhere to go. So you've got their full attention.
All right, so let's see. Stop video. All right, shall we try that?
Yeah, still sounding a little funny, but let's give it a try.
Oh, boy. Is it any better?
Yeah, go
Me
ahead.
differently, and I apologize. No matter how many times you try it, it doesn't seem to, you know, when it comes to acting, it doesn't seem to all the trial periods. So what I was saying before we were rudely interrupted there was that teledentistry had almost reached its tipping point. We had just returned at the end of February from our first annual National Mobile Dental Conference. It was sold out twice. They kept expanding it. More people came. We had such great connections. We had practicing hygienists who were going to go out into the field and dentists who were, and a great time, and the American Dentistry Alliance was established at that time. So we thought we were moving forward. We thought it was going to be a great time until, you know, who would have known 2 weeks later, this little guy would have hit us. So I'm going to tell you a little bit about what I've done in the past and where we're going in the future with teledentistry. But before I don't want to miss a chance to thank Plan Mecca for sponsoring this educational grant for this program. I have been a user as a clinical hygienist. 2020 is my 40th year for practicing, and I have been a user of their non-sharpening instruments through LM Dental for a number of years. So it's always nice when we can have a little bit of what I am doing, although this is not about me. Because I do also lecture on ergonomics presentation, so I just want to make sure I'm crystal clear with you all, very transparent as to where my thought process comes from. I am an employee.
Cindy, I'm so sorry, but you're still going in and out quite a bit. I don't think we're catching most anything.
Of dental work.
Hey, Cindy, can you hear me?
Internet off?
Yeah, it's still quite bad.
Yes, I can.
It's very choppy. We're only getting like every fifth word or so. I'm not sure.
I don't have any other things. Oh my goodness.
I know. Like you
I
said,
don't have any other things on. Phones.
I was just wondering, maybe you could call in and go on mute on your slides. I can, that might actually work because it seems to be an audio issue and not your slides showing. So in the invite, there should have been a phone number to call in. Maybe if you call in on your audio and then go on mute within the Zoom, that might help.
And just talk on the phone?
Yep.
Oh my goodness, I'm so.
It's okay. It's okay. We're hanging with you.
It's not really good to do program and have not work.
Thanks all for being patient. We like I said, we've done a lot of these webinars. We've only lost one other presenter for a few minutes whose internet went completely out. And then we had issues on Wednesday where somebody's slides weren't showing. So we had a really good batting average until this week, and we've taken a bit of a dip. So I'm going to go ahead and go on mute and we'll hang tight and hopefully she can get connected. Thank you. For those of you that are just joining, we are having some technical difficulties with with Cindy's audio connection and internet connection. So we've asked her to potentially call in on the phone and then be able to share her slides. So Cindy, I see you and I see your slides, but I don't know, I don't hear you yet.
Can you hear me now?
Yes. with a phone. All right, everybody's been very patient and they said they would wait hours to hear you speak. So I think that says a lot about what they're hoping for.
Oh, so sweet. I hope I'm not getting feedback. I am hearing it through the phone, so I'm a little discombobulated, but that's okay.
That's fine. If you just want to make sure that your computer is muted, and then obviously for your other videos, we probably won't hear the sound, so you might have to just flip through those. We are pivoting as good as we can here, so thank you all. Cindy, we can't hear you if you're talking. Cindy, can you hear me?
Can you hear me? Hello?
Yes,
Hello?
now we can. Thank you.
Oh, if I unmute on the screen, then you can't hear me on the phone for some reason. So I'll just go with having an echo.
Okay, sounds good. Thank you.
I always feel sorry for so many people who have problems like this. Now I feel sorry for myself. Okay, so I'm going to move forward and pretend like none of this happened. So here are our objectives for today. This is what we're going to try to meet. I would like to say, though, that this is a new arena for a lot of people. So if you're considering going into this field, please consult an attorney. There's a lot to be seen and known. It's different for every single state. So just keep that in mind. So we're going to try to, I'm going to share some successful teledentistry use cases that were prior to COVID-19. And that is actually my practice, where I practice dental hygiene. And we're going to discuss the benefits and the challenges during COVID-19. We're going to walk through a decision-making process if you're interested in taking on this project. And then we're going to explore how technology can create solutions for the future of dentistry. Okay, now I have enough things in my hand, different clickers, and I got discombobulated here. So before coronavirus, we were all very focused into our own little world, the details of our own world. We were all just going ahead with our lifestyle the way we were used to. And this was my lifestyle. This is where my teledentistry practice is. This is where I live. And as soon as y'all are finished looking at those beautiful mountains, I want you to bring your eyes down just a little bit to where those houses are. That is the entire town where I serve. You can see that there's a lot more ranch land than there are people. We have probably more cattle per square acre than we have people. This is in southern Colorado, there are only 1,000 people there are two towns together, and there are only 1,000 people in the two towns together. So our practice is only open, I only work probably 5 to 6 days a month, and then the doctor comes probably 3 to 4 times a month. And I'm a satellite office of this doctor. His office is about 60 miles away, and he has a full practice with 2 hygienists, and then I am his additional practice. We are, as I said, we're in Colorado. This is a health professional shortage area for dentistry. And this one, I believe, this was January 2020. Every year this map is in a different color, but it doesn't matter because my little county, which is right here, is always in the top area with the most shortage. It says non-metro and micropolitan, because I am the only dental practitioner that lives and works in this county. There are a couple other hygienists. Last I checked, there were one or two who still live in this county, but they work outside of the county. We don't have a dentist. We don't have a dental assistant. So it's rather remote, rather rural. But the backstory is that I came here from New Mexico, and I was going to open up my own independent practice. And there was one dentist who was here. He came in from Florida 1 week a month, and practiced for 5 days. And he basically was here because he wanted to ski and bicycle ride and go to the music festivals that are down there at the base of the mountain. But long story short, I wanted to use his facilities when he was not there. And he and his wife had a different idea about that. And I ended up working for him actually for about 3 years. And he ended up having to retire due to unexpected musculoskeletal disorders. He had surgery in his hands that did not turn out very well, which is ironic because, as I've already said, my other topic I lecture on is ergonomics. Should have listened to me a few times, but anyway, he ended up having not very good results after his hand surgery, had to use his disability insurance. And I was able to practice with his disability insurance. I was able to keep the practice open for a year. And during that time, I was working by myself, and I would take all of my restorative cases and refer them to this doctor in Pueblo, who I had already worked for, I had temped for, I already knew what kind of dentistry he did. We had a great working relationship. So after the year was over, well, actually it was before the year was over, I had a very humbling experience happen. I felt really good because I felt like I was offering this access to care to the entire community, and they should be happy about that, and because I was happy about that. And I had a patient walk in while I was with one of my hygiene patients. Now, what I haven't told you is I am not working independently. I am working as an employee. I am working in my state, it's called indirect supervision. The dentist just has to be aware of what I'm doing, and that is why I can do that here. You can't do that everywhere, and we'll get into that into a little more detail later on as to the different descriptions. But anyway, back to my story. A gentleman walked in, a very big, tall gentleman walked in and demanded that he be seen that day, and he needed an extraction. And I very nicely explained to him that we could not perform those procedures here, but I had a connection with a dentist an hour away, and I could call and get him into their emergency time, and he would be fine. And he was adamant that he could not drive that hour. It needed to be done right at that moment. And the patient actually that I was working on in the chair yells out to, he yells out to me and says, "She is doing just fine. It is working. This is working great for me. So could she come back here and get her work done?" But the gentleman looked at me and said, "This is not going to work. Our town needs more than this." And in my head, I thought, well, I can't make a dentist move here, but I never let go of it. I couldn't sleep that night. I knew that that gentleman was right, and I was not serving the community needs. So at that point is when I realized I needed to do more. And that's when I went to the dentist who was 60 miles away and said, "Hey, we need to offer good care to these people, not just at my schedule when it's convenient for me, and not the few services that I can offer, the prophy, the fluoride, the x-rays. They need full comprehensive dentistry, and they deserve it." And he said, well, how are we going to do this? And I had worked with a teledentistry programming company. And I said, I know how we can do it. I pulled out my computer. I showed it to him. I showed him how we can connect. And that I showed him that it was legal in our state. And he did agree to it. I am so grateful that he agreed to it. And he moved in, he bought the practice, he kept his practice 60 miles away, but he would come up maybe on a Friday. He bought a second home here. He would spend the weekend, and then we would see patients on Monday again. And we felt like everything was working well because we were giving our patients equality of care. We were giving them the same care at the location that everyone could access. And we felt like we were doing the right thing. But the more I got into the community, you go to the rodeos, you go to the parades, and you talk to people, and you learn what the people are really like, you become more patient focused. And I had people tell me, oh, well, it's all well and good that you all are here, but too bad you don't take the state dental insurance. And I thought, well, we don't really want to get involved in that. It's very, as some of you who are involved in it know, it's very complicated. So what I did is we started looking at the grants and things that were available for this community. Went to the public health department and said, do you all ever get grants? Do you ever see grants that are for dental? And they said, yes, but we've never been applied for them because we've never had a provider. And I said, can you write the grant? We will be your provider. So now we are able, we were given a grant that's sustainable, and we are able to treat all of the children under 18 in our county for free. And it's renewable every year. And we've never used all of it. I can't say that we've treated every child, but we've never even finished using the total amount of it each year. So we just keep getting it back, more of it back, and that we can use to help the community. And then we found out that the county next to us has an aging grant, and all people over 62 or something, there's a little bit of a financial consideration, but they get $300 a year to use on their eyes or their teeth or hearing. And so if they would come to us with an emergency, we could treat the emergency for that $300 that they get. And then we'd say, and come back to us in January, and we will take your $300 and get a full mouth set of x-rays and a comprehensive exam, and we won't have to be fighting fires. We will have a plan waiting for you when you're ready to come and get your work done. So I really felt that I feel like we have reached, again, I will say, the tipping point where those that need more are getting more. And so this has been pre-COVID. We've been pretty happy with it. We consider ourselves a hybrid private and public health office. Again, I'm a satellite office in a rural area. We get to use extended and variable dental hygiene hours where I can come in. Our school is off on Fridays. I can come in on Fridays when the kids are out of school, or if someone needs a late afternoon. I just kind of change my schedule when I'm in town, when I'm not lecturing or working for another company, but it helps to meet their schedules. And the doctor does the dental diagnosis and treatment planning from his office 60 miles away, and then comes up here to finish the restorative care when they need it. And I'll show you, we'll get into the teledentistry programming that I am using to accomplish this. But full disclosure, full transparency, I have decided during this COVID situation that I will not be returning to that office. So I wanted to let you all know I have been doing it for 3 years, but as of today, I have decided I'm not going to return there. Just for a number of reasons. I have decided that I created the program, or I helped to create the program. It's well established, but I don't have to be the one that sustains it. These 2 hands and 10 fingers who are getting a little old, I don't have to take on full responsibility for everything. So I was able to get another hygienist to move here in town from Oregon, and she's going to take over as soon as we're all able to go back. But teledentistry was the solution. Teledentistry was the only way that I could make this happen. And we're very fortunate that telehealth and medicine has advanced to the point that it's acceptable by the public. It's much more acceptable than teledentistry is at this point. So the definition of telehealth is that it encompasses a wide variety of technologies to deliver virtual and educational services. So it is not one specific service. It's service. It's an umbrella of services, and there are small divisions that are underneath that umbrella, and that would be telemedicine or telepsychology, or they even have telewound healing. And then of course, teledentistry falls under that umbrella of telehealth. The problem we have is that there are inconsistent definitions of telehealth from state to state, or even from organization to organization. But really the simple answer of what telehealth is that it's the use of electronic communication to provide or to support health care when distance separates the participants. So two people in different areas, different settings, but still delivering healthcare support. Here, and there's been big trends in telehealth, and this was before COVID. I can't even imagine. I'm sure it's 3 or 4 times this number now that we've all been in this situation. But the statistics tell us that 70% of the consumers are open to using telehealth services. 19% have already had one, which is the number I'm sure is going to go up by 4 times at the end of this. And 83% felt quality of care was as good or better. And that's the key. If we can deliver the same service and do it through telehealth, we can reach more people. Then we've got it right. Then we've got it right. So the definition of teledentistry, quite simply, is telehealth plus dentistry. I think it's simple. There's a lot of confusion. I guess I do understand. I mean, we can't do a root canal or an extraction over the computer. But so here, let me give you some answers as to who and how it gets done. Generally in teledentistry, there are 2 providers. One is on site and one is in a remote location. But the on-site provider is the one that is with the patient and is delivering the healthcare. They're the caregiver, and that can be a dental hygienist or a dental assistant. It can even be an emergency room nurse or a assisted living professional that can be delivering pictures to a dentist to diagnose. So the remote location is actually where the diagnosis is done. So that would be where the doctor is, the diagnostician. And the treatment plan is being done there. ADA has given us 4 different types of teledentistry modality. And I know some of you have seen some teledentistry programming since we've all been taking webinars. So some of this may not be new to you, but they have, number 1 is live video. That's called Synchronous. It's easy, just think of it as FaceTime. The second type of modality is store and forward. That is called Asynchronous. That is what I use, and I'll get into explaining how that happens in just a little bit. And then the remote patient monitoring. That is more like pH test, or if you think there are some toothbrushes that have an app and they can deliver to the dental office the information as to how long they've been brushing, that's considered remote patient monitoring. And then there's mobile health. Mobile health is like wearing a Fitbit. So basically in dentistry, we really are only using live video and store and forward, or the synchronous and asynchronous. So for live video, all that is needed is a live two-way video. An intraoral camera and a webcam will do that. For store and forward, as I said, it's collecting the data on site, and then you send it up to the cloud, you secure it. And when I say data, I'm talking about x-rays, intraoral pictures, copies of patient forms such as health history, periodontal charting. All of that gets collected and put into the cloud through a teledentistry program. And then the dentist, the diagnostician, can pull that information down remotely no matter where they are at a later date. So all of this is called provider to provider. In the past, teledentistry worked best when it connected a dental provider to another dental provider. And it could have even been involving a referral, a specialist. It still could have been the dentist to the specialist. It was always provider to provider. And here, again, is what I was saying you would need. Tablet or laptop to collect the data, intraoral camera in the past, and a teledentistry software. The diagnostician needed the same thing, a computer, smartphone, tablet, and an internet connection, which obviously has seemed to be a challenge for us today. This is what the dashboard would look like. The diagnostician would pull up something like this. This is just one particular company. They all have their own different dashboard, and it has the patient's name and when the appointment was, and then he can click into the exam and see all of the x-rays, all of the information that he needs to gather to do a complete diagnosis and a treatment plan. Here are the settings that we were being very successful before COVID. As a satellite office, it doesn't have to be rural. Mine is rural, but you can certainly have satellite offices in a metropolitan area, have more than one office and have everyone connected. We're seeing a lot of mobile programs such as mobile vans. It was being used for extended hygiene hours, as I said. It was being used for corporate pop-up. If you're not familiar with corporate pop-up, that is when a dental office sends a hygienist out, or even a dental company. There are some just dental companies that were offering this, but they would go to a corporation that's big in your area, such as Hewlett-Packard or Apple, and they would actually offer preventative services to the employees at the facility where the employee was working. Very successful, actually. There are school-based programs. There are elder care in nursing homes, assisted living. And we were seeing some medical and dental integration in pediatric offices and OBGYNs. I do want to make a point here that if you are filing an insurance claim and you are in a different area, you have a remote setting and an on-site setting, you do have to file your claim differently. You have to, as you can see in these arrows, you can demonstrate that the dental setting was in had one address, and the diagnostician, the doctor's address is different from where the services were being performed. And then you do have to change on line 30, box 38, you do have to change that your place of treatment was not in the office. So what benefits were we seeing from this provider to provider situation? It was a very efficient scheduling of the dentist when he came to the location. All diagnosis was already done. The insurance information was already checked out. The patient already knew what their payment was going to be. So when the doctor came, all the doctor did was productive work. Just pick up that handpiece and keep on working throughout the whole day. And again, I loved it because it was a very comprehensive community outreach. We were reaching people who had in the past been unreachable. We were going to where people were living and working and playing. And it's very gratifying to be part of that community. We were also seeing that it was simplifying collaborative agreements between a dentist and a hygienist who was either practicing independently, or there's a lot of different collaboratively. Because a lot of dentists were finding that to work with a collaborative hygienist and using teledentistry, it wasn't taking up a lot of their time in a dental office. They could do it, they could diagnose and do these exams during their leisure time while they're sitting at home on the couch or whatever. And then we were also seeing that it was really helping authorization of services. There are some hygienists in different states that need to have permission to do a sealant from a dentist. The dentist has to diagnose it and authorize the treatment plan before they can place a sealant, before they can place an ITR, which is an interim therapeutic restoration. So the dentist and the hygienist could connect live. He could see the pictures, he could see it, either pictures or he could see the live patient. He could give his authorization for the treatment, and the hygienist could go ahead and do that treatment that day. It wouldn't be that they could screen it one day and then come back in a week and we'll see you again. It could all be done in one visit. So it really was working very well for a lot of people. We were seeing a lot of advancements. And again, I consider these benefits. I mean, how many of us are sick to death, those of us who are traveling, sick to death of carrying files, patient charts everywhere. So it reduces that, it's all digital. And you could have your consent forms customized onto these teledentistry programs. So you could have all of that authorized before you even started treatment. Don't have to wait for that time to be signing them. And we were seeing a lot higher completion of treatment rather than handing out referral slips. Because we could connect the specialist in with us, they could exactly see what we were doing. The patient could see the specialist, they would have a connection, they would almost feel like they already had a home with that specialist. And there are some statistics that say, and I have done this my entire career, but there are statistics that say if you hand a patient a paper referral slip, only 46% of those patients follow through with that referral. And here's what I've done. I've also given them a second option, thinking, who am I to choose? They might like this other guy better. The statistics tell us that if we give them a choice of 2 referrals, completion of treatment goes down to 33%. So, and just another way, teledentistry, if you can connect in your specialist, is a faster way of completing that, and probably a more probable way of completing that treatment when we're referring to specialists. But then this little bugger came into our lives, right? And shut everything down, closed my blooming world, basically, is how I looked at this picture. So I just thought I'd show us all some teeth. Do you all miss this? I can't stop looking at teeth on television. More so than I ever did before. So I'm kind of missing the teeth that I don't get to see, our love of our teeth. I miss my patients. I'm sure you all do too. And I can tell you, they miss us, but they're going to have some problems, I believe, coming back. I believe they're going to have some post-traumatic stress disorder about walking into our offices. I mean, we have put them in charge of their sanitation and disinfection and quarantine for the past 6 or 8 weeks or whatever it's been. And they're a little hyper about it. And they think that they know more about it than they did before. And so I think they're going to be a little afraid to come in. I know there are some people who are thinking they're going to be slamming, jamming, busy, worrying about how they're going to make up for all the time that they've lost and get all those patients in. But I think it's going to be a little tentative, actually. So I think we could we're going to have to show them that we are on top of everything, that this time off has improved our team collaboration and that we are there for them better than we ever were before. That using this teledentistry product is going to be beneficial to us. We're going to have better access to these specialists. We're going to connect them face to face. That there's better connection between us providers, that we were doing education in between time and we are ready, willing, and able as a team to treat them. And we're going to have to convince them that all of this is going to deliver a better outcome to them, that using teledentistry is going to keep us connected to them. We're going to deliver better service to them. Because a lot of people left messages on their telephone that said, we're not here. If you have an emergency, go to the emergency room. That was saying, I'm not there for you. Even though we didn't know what to do. We too have PTSD. But I think we can use teledentistry to show them that things have changed and we have followed the advancing technologies and it's going to fit your situation better and we're going to do better service. So when we move forward here into this next section, I want you all to just wipe your slate clean. I've had to wipe my slate clean as to what I knew about teledentistry, but I want you all to wipe your slate clean about what you know about practicing and how to practice, because we are going to have to step up and there are going to have to be changes in our protocols. Right now, COVID has brought us to, teledentistry is now patient to provider. It is no longer provider to provider. I'm a little disappointed here as I look at this Jetson picture. I thought I was going to have a maid in my house 24/7 by this time, but I guess I'll take teledentistry. That's at least a step forward. So what has happened at this point is the Office of Civil Rights has said that it is okay to use different types of teledentistry that are not exactly HIPAA compliant. They are going to not charge us penalties if we use a device that is non-compliant for healthcare providers and we are doing it in good faith. But I want you to think that does not completely get you off the hook, because if your patient's personal health information gets compromised because you're using an unsecured type of program, you can still get sued. You are still liable for that. So they have specifically said that we can use Zoom video chat, we can use Skype, we can use Hangout video chat, we can use Messenger video chat. But they have not said anything about using email or text. So you are kind of on your own for that. And if you have to use those, if you have to use a non-secure system, you need to put it in the patient record that you have gotten their permission to use a non-secure system. And then you have to demonstrate that you have done a risk analysis as to why are you using this non-secure system and how you implemented a reasonable and appropriate safeguard for the patient. So they're really wanting you, they're really going to hold you to the fire, basically. And they're only going to honor this for a limited time. At this point, we were hearing 90 days and from about when it all started, and that was the middle of March. And I wanted to show you this, even though they said they're not going to charge these penalties, I wanted you to see what they normally are, because they are not just a whistling Dixie on this one. They really mean business. These are some big violations if you are not using HIPAA compliant teledentistry programs that are going to protect the patient information. So this is how it's changed. This is how it looks different when it is now patient to provider. The data is collected at the originating site and the treatment plan is done at the originating site. So basically it's the patient calling into the dentist, showing him pictures, of his mouth without an intraoral camera using their home phone. And then the dentist, there's an internet connection and the dentist can make a diagnosis and treatment plan and can decide if the condition is urgent or emergent and the patient actually does need to come into the dental office. And using teledentistry, you can minimize the time that the patient will be in the office because you can already have their healthcare information, their consent forms done. You can have already explained what is going to be done, and they will know ahead of time the treatment plan and the schedule. You can bypass the waiting room. If you have, usually people are saying just call or text us when you get to the office, but that is not ever part of the record. It is never the dentist showing I showed. I tried to keep them out of the office as much as I could. I was trying to reduce their exposure. If you have them message into this teledentistry program, there's a portal that they can get into, then that it becomes a record, part of the permanent record that you had the patient wait outside, they texted in at this time, you brought them into the office and you started treatment at this time. And then we can also do our follow-up dentistry. If you want to, you can even send that patient home with one of these intraoral cameras that plugs into a USB port and they can report back to you. You don't have to do that, but some of these cameras are so inexpensive and so affordable at this time for big cases, or if it's a really an emergency that you are very concerned, I need to see that in 3 days, but you don't have to come back in, just take this camera and take a picture. Send them with all of the coverings for the camera and a baggie with maybe the red biohazard symbol that they can just put it in the bag and bring it back to you when they're finished, when you see them in the office the next time. Just a lot of different creative ideas if you're really trying to keep them out of the office. These are the teledentistry codes that exist. They have been around since January of 2018. For synchronous, remember that real time, like FaceTime, if that is how you're seeing patients, which is basically how we're seeing them now in this patient-facing scenario, is D9995. Asynchronous, which is the way I used to do it, is D996. Insurance companies have said that they will pay for those codes. I'm not seeing them pay more than about $14. I have heard people say up to $40. But you use those codes in conjunction with the services that you provided, which would be D0140, which is a limited oral evaluation. The insurance companies have also said that a few of them, and I'll give you a list of some of them, have said they will pay for D0170, which is a reevaluation for an established patient. You code what you did, and then you add the teledentistry code onto it so that it's kind of an explanation of how you performed that evaluation, especially in this time when we're not supposed to be treating patients other than emergencies. It has also been recommended by ADA that we use these two codes for teledentistry. I have not seen these paid for as much. So it's D0170, which is a reevaluation. If you have to see them a second time after that initial consultation, that initial evaluation. And then D992, which is a case management code. It's basically used if you would have to do a consultation about that patient's condition, particularly like with a medical doctor. But again, I have not seen these paid by as many insurance companies regarding teledentistry as the 0140 and the 0170. Your charting has to be a little bit different when you're doing teledentistry documentation. You need to make sure that you document the method of obtaining the data. You have to say in your chart notes, obtained through a video, an email, an image. You want to designate the time that you did it and the date that you did it. You also have to put the expectations of this diagnosis, that you have to inform the patient that this may be an interim diagnosis. The patient has to consent to that. Yes, I understand that I may need further treatment later on down the line when this is all over with. And then you also have to give them the risk for a successful outcome by waiting during this interim time. You also have to note where the original site was and the distancing site. In this case, it may be the same thing, that you're diagnosing and treating at the same place. Sorry, let's see what's. And take note that if you are prescribing a medication, that it does have to be still a live video. You have to do that over a live video. They're not letting us get by with, before they had to be in person, basically. So here are the benefits of using teledentistry during this COVID problem. You have reduced exposure for your patients in your office. They don't have to travel to your office as much. They can abide by the stay-at-home regulations easier. And you are delivering care in accessible locations, which at this time seems to be their home, at least some care. And again, more efficient scheduling. You know what's coming in if you're bringing in for an emergency, and you can not have other patients around if you know that they're COVID positive, things like that. But there are challenges, y'all. I don't mean to make, as we have had challenges today, I don't mean to make it sound like this is the easiest type of practice I've ever been involved in, but it does help. We do grow through a lot of this. Again, I should put this slide in here 6 different times for trouble with electronics, but it is electronics. And as we did today, you just keep working through it until you can make it through it and connect. We all are having to do electronic health records. It's all coming, whether we want it or not. But they're finding out, studies are saying that MDs are spending twice as much time updating their electronic health records than they do with their patients. They're saying out of a 20-minute visit, 14 to 16 minutes are spent on that electronic record. They're not really interacting or treating the patient, but 4 to 6 minutes. So we don't be worried. We are not taking time away from our patients. And the patients are sort of used to this because their doctors, their physicians are doing the exact same things. They are all using electronic transmissions. So seeing is believing. If you have someone that you're trying to take pictures of using teledentistry and they're at their house, it is not easy. So here are some of the directives that you can give them. If they are on a laptop, have them get some type of light source behind the laptop so that the light is pointing to their mouth. Maybe it's a friend holding their cell phone and putting a light on it or not, but get it behind the laptop. Bring the laptop as close to the edge of the table as possible so that you can get a good view of the mouth. Make sure you have them wash their hands prior and post of taking that picture. And as I said, they might need some, if they can, if they're not living alone, have them do this with some help from someone in the house. And have them practice, like have them raise their right hand. The doctor says, raise your right hand, so the doctor gets an idea of which is the right side and the left side, because some cameras are reversed. So we want to make sure that we're diagnosing the right tooth. If the patient is using a cell phone to do teledentistry, again, get another light source behind the cell phone. They might even lay the phone on the floor, on the tabletop, prop it up a little bit, and lean over it. Make sure they have it on selfie mode. Make sure the flash is on, and put it on the timer mode, at least 10 seconds, because it's going to take them a while to get adjusted, pull the cheek back, the doctor to get oriented as to what tooth he's even looking at. So again, wash hands prior and post. So that's actually the mechanics of it. Another challenge is that there are variations in state regulations. This cannot be done in every single state. Every single, I get this question asked all the time. Can I use teledentistry in my state? The definitions differ from state to state, but generally, if your state practice acts uses verbiage such as general or indirect when describing the supervision of a dental hygienist, probably more friendly of a state, you probably will have more opportunities to use teledentistry. Same thing if you have the word collaborative in your state practice acts. Here in Colorado, we have indirect, but some places call it direct access or independent. If you have mid-level practitioners allowed in your state, much more teledentistry friendly. And there are some states that have a public health dental hygienist, and there's extra training to become a public health dental hygienist to qualify. And so therefore, their restrictions are a little more relaxed. So any of this verbiage is probably going to be a little more teledentistry friendly. But don't just do it on your own. I highly suggest that you contact the dental board and that you also contact an attorney to help you go through all of this. If you look at this slide and you would look at it, it's state by state. If you would look at Oregon and Colorado on the left-hand side, you would think, oh, those two states are pretty much the same. They can pretty much do the same procedures, supervised or unsupervised. I can tell you they're completely different because descriptions are different, definitions are different between those states. And maybe you can give anesthesia, but you have to be supervised. Sometimes you just have to have a collaborative agreement. It's all different. So, I mean, you have to just go into your state practice acts and drill down. When I lecture at different state associations regarding teledentistry, I have to peel through their state practice acts before I do the presentation for every single state. Someone said, and it might have been Dr. Paul Glassman, the godfather of teledentistry, who said, if you've read one state practice acts, you've read one state practice acts. They are all so very different. And not only what the services you can provide are variable, but your reimbursement is variable from state to state. There is such a thing as called a parity law regarding telehealth. And a parity law states that if you are providing the same procedure, whether it is in person or it's virtually, to the same quality, then you must be reimbursed at the same rate as if it were done in person. The problem, the disparity comes in, is this is a telehealth legislation. Now we have to question, does teledentistry fall under the same legislation as telehealth? I would say yes, but not every state seems to agree with me. Some of them have specific parity laws for teledentistry, and it may just be a partial parity law. That yes, we will pay, but not at the same rate. So all of these are important things to know before you go into a practice like this, before you start to establish a practice. So the disparities that we don't know if telehealth laws apply to teledentistry, or it's questionable. And then there is a difference, there's another disparity between what the parity law says and what the practice acts say. So some practice acts may not release reimbursement monies to a dental hygienist. It has to be only given to a dentist, even though the procedure was the same and services and outcomes were the same. So something else you need to check into. There are parity laws for each state, and I will share that with you in just a minute. And then with regard to Medicaid, there are quite a few Medicaid reimbursement laws that have been relaxed during the COVID-19. But our question, in fact, Medicaid's paying the most from third-party insurance for this. But our question is a dentist regarded as a doctor, a Medicaid doctor? And I will show you something that proves that they are. But it doesn't mean that all Medicaid, state Medicaid facility directors are abiding by that law. So again, if you're going to do Medicaid in your practice, I would suggest that you contact your Medicaid office. Some offices, some states require a certain type of transmission. They will only allow teledentistry, but only in the live video form. So you have to be very specific about that. And some even have geographic location restrictions that, yes, you can use teledentistry, but the provider and the diagnostician have to be 60 miles away or 30 miles within a metropolitan area. So read everything thoroughly and use a fine-tooth comb. So here's a map of some of the state parity laws. This was as of 2018. That's the most recent one that has been out. Shortly, I would imagine we would get the 2019. So the ones in orange at that time have telemedicine parity laws. The one in blue have those partial parity laws. Yes, we will pay, but maybe not as much. And then there South Dakota and Pennsylvania are in the process of, and Alaska are proposing parity laws at that time. And sometimes they restrict, Medicaid will restrict, yes, we will pay for teledentistry or telemedicine, but we will restrict it to a certain number of providers. So they actually list the providers. I do not see dental hygienist in there. I do see dentist. And then you can see the states that are a little more open. My suggestion is if you're a dental hygienist by yourself who's trying to get reimbursement, you might try to get the legislation changed if it's not indicated in your state. Here's Medicaid's definition of a physician. Dentists are in there. The term physician is limited to doctors of medicine, doctors of osteopathy, doctors of dental surgery, or of dental medicine. So Medicaid considers dentists a doctor. The absolute best place to go to learn about these parity laws and these reimbursement situations is to this website, the Center for Connected Health Policy, Center for Connected Health Policy. And it is an interactive map. You just click on the state and it will tell you everything that you need to see. So highly encourage you to hit this page. This is from billing. We're going to talk about billing. This is from the ADA interim guidelines. These are companies that have said that they will pay for teledentistry during this time. Again, some of them have limited it to 90 days, which would put us about the middle of June. So you might want to double check on that as we get closer. I couldn't even put them all on there. It changes every day. So there are more, but go to the ada.com and you will be able to find this information. But it's good that they are doing it. So before I am certified as a telehealth facilitator. I have taken courses that I am certified to go into a hospital and initiate and set up and be responsible for setting up this whole telehealth connection with the internet connection, which is very ironic for the problems that we had today. That's probably why we had connections today. But this is some of the information that I got during that certification course of how to be prepared before you even get on that connection. So you need to establish a schedule of availability for your patients. You need to tell them when you are available for teledentistry. You don't have to make it 24/7. You don't have to be connected to your computer. Just tell them, I am doing teledentistry exams from 10 to 2, Monday, Wednesday, and Friday. You can connect with me then. You need to decide if you have an all-in-one teledentistry system that will store all of that information together. And you will understand this portion of this question a little bit more in a minute, because the teledentistry programs are a separate practice management. It's not the same as your practice management. If you have this all-in-one system, you will have your Dentrix or your EagleSoft, and then for your teledentistry, you will have a separate system that can contain your x-rays and your intraoral pictures. So you need to know which one to have open during your teledentistry exams so that you can treat the patient, and where you need to know where to load all of this. And you also, some of them are currently starting to integrate with Open Dental and a few other ones. So you also need to know if your teledentistry program integrates with what you have. Otherwise, you can go in and just open up your regular practice management system. And know what technology you're comfortable with. If you're going to be doing this over the phone and you are familiar with the iPhone technology, don't go out and get a separate phone that's an Android. You're not going to understand it, and you're not going to be able to serve your patient very well. And you need to decide, do you want to use your personal phone, or do you want to get a separate number? Do you want all of your patients always having your personal phone number, or do you just want a phone that you turn on during those hours that you have already scheduled for teledentistry? And you need to know we're going to do it at your house if the dentist is at home. This is funny that I'm going to say this out loud, but you need to understand where the Wi-Fi is strongest in your home, which we're wondering if that wasn't my problem. And go to the, move to where it's more robust if it's not receiving very well. And again, remember your HIPAA regulations. Don't be doing it out when you're on a golf cart and everybody can hear. HIPAA regulations say it needs to be in a closed, quiet room where other people can't have access and won't be hearing that conversation. And have your questions ready to ask the patient, because if you have that phone on 24/7, if that's your emergency contact, it's going to happen in the middle of the night when the baby's been crying and you didn't get any sleep. So write them down, have them on your table next to your bed so that you can ask these questions, and then you can write the answers down so that you can later transfer it into your record. But make sure you get that informed consent from the patient initially that you are doing a teledentistry evaluation, and that is an interim diagnosis. And you can even tell them the fee for that ahead of time to get their permission. And then go through all your questions. These are questions that everybody already knows to ask the patient when they call in with an emergency anyway, even if we're at the office. And again, I would ask you to ask for their phone number at the very beginning, in case there's a disconnect, so that the doctor can call the patient back. So again, reconfirm who this is and what their phone number is. So then, go on with your medications and your medical history and all that kind of stuff. Then your next questions, don't forget, you need to ask your COVID questions. And you need to, that will help you determine if you can see that patient in the office and how you will need to prepare for them. And these are just standard questions that we've all heard on the news. So no big deal. I'm just put them here in case you wanted to take pictures of them. So we will get through it, y'all. I promise. There is going to be an active COVID virus situation, and we can still use teledentistry. I believe that we're going to find out that our patients really liked it, that it was really beneficial for them. They're going to expect us to continue to use it because they're just going to be used to technology. They're going to be, they kind of like seeing the doctor while they're sitting in their yoga pants at home for certain situations. But if you are thinking about continuing this, there are considerations that you need to look for when you are purchasing software. Your software should have certain features. And using teledentistry software should be familiar to everyone. It's nothing different than we haven't used for our other practice management, except for this information does not live on your server in your computer. It's just stored in the cloud. That's the only thing that's really different. So you want to make sure that the software is HIPAA compliant, and generally that means it has to be encrypted and it has to go into the cloud to be saved. Encrypted means someone has to have a password to get into it, so not everyone has access to it. Make sure it has that live video capability so that you can prescribe prescription medications over the phone for pain. And make sure that it also has that store and forward evaluation in case you're at some place where you don't have that interconnection and you have to keep it stored. So just make sure that it has the capacity to send data in a clear, organized, and secure manner. And I'm sure you all are thinking, but why do I need a teledentistry program at this point? Traditional software is very inefficient at managing when we are out. I'm talking about when we are in the field, because there are different types of scheduling processes. Someone who's going into a nursing home is going to be scheduled different than someone who's doing this treatment at a school-based program versus sitting in our traditional offices and scheduling. And the amount of time that we're going to give the patients is different. Sometimes the procedures that we're going to do is different. And the products that we're going to need to do that are going to be different. We're going to need different types of sterilization. Everything is different. If you're trying, it's very difficult to use a traditional software in a teledentistry setting. So here's what we said. You're going to be scheduling in multiple locations. Those locations are going to need different types of equipment and supplies. And a traditional software program does not allow you to communicate with the administrators, the caregivers, the parents, the guardians. I want to be able to send out a letter. If I'm in a nursing home, I want to send it to a guardian of this, an adult guardian of my patient, to tell them what I did today for their mom and why I did it, and send a picture of what it looked like before I applied SDF and a filling, a temporary filling, a glass ionomer. Sorry, I couldn't think for a minute. So that they can see the difference and they know what their parent, what their mom got that day. I want to be able to send it to the administrators at that nursing home to let them know what I did that day too, what my value is, what I'm doing for their patients. I want to, and think about a child in a school-based program. You know, if you send a letter to home with the kids that there's a suspicion, we did a cleaning today for your kids, and there's a suspicious area on tooth number 4. That letter gets shoved in the bottom of the backpack, and 3 weeks later, when it's stinking because there was an apple in there that we all forgot about, right? That gets pulled out and it's all wrinkly, and the mom's like, oh yeah, throw this away, this is gross. But if on that piece of paper there was a picture of what tooth number 4 really looked like and the decay that's in it, she's going to make some decisions, and she's going to start connecting well, now I understand. Now I understand why Susie's not eating dinner at night, why she pitches a fit, why she cries, why she's not sleeping at night. So as they say, a picture is worth 1,000 words, basically. This is what I want out of my teledentistry software. The software that's out today doesn't quite have all of this, but it will. I want to know, I want to be able to tell the doctor these diagnostic records need to be reviewed. And I want him to be able to communicate back to me, yes, Cindy, I've done the evaluation. It is completed. And then, but I need you to take an x-ray of tooth number 16. Bring the patient back for a PA. I want to know if there's additional information, if he had any questions after he did the evaluation and he needs more information for the treatment plan. I want to know if all follow-up tasks have been completed. If he sends information to the person at the front office that says tooth number 16 needs to be extracted, please call the patient. I want to know if she's done that. I want to see all these completed tasks, conversations back and forth, as if we had been standing in front of each other to make sure that that patient gets complete control, a complete cycle and complete treatment of their problem. And I want the patient to be notified that the doctor has reviewed the x-rays and Mary will be calling you to schedule an appointment by Tuesday. I want the patient to know all the steps. I want them to have access to their treatment plan. It's coming. There's a lot of it that has come on board with these types of task communications. But these are all very difficult to do with a traditional software. I'm sorry that I keep hesitating, but I'm still hearing an echo back and it's hard for me. I want to make sure I'm sounding competent here. So anyway, if you're thinking about doing it, what software program should I choose? How do I choose a vendor? And how do I know that it's the right one? There are so many vendors out there right now offering teledentistry. And the term teledentistry is, I think, more confusing now. Some of these names on here are just, I would say, like 1-800-dentist on steroids, in that they give you more services. You can connect to a dentist. He will diagnose what your issue, what the patient's issue is. But some of them are not treating dentists. They will refer you to a dentist who has emergency services and you can get the work done by that other dentist. I don't know that that is what all of us are looking for. Some of us might be. We all have different needs. There are some here, let me look at some of them that I see. Some of them are full comprehensive, that you can make an appointment with them for teledentistry. You can have the treatment done and you can make your payment, all with one program. Your x-rays can be stored there. Your intraoral pictures can be stored there. It just depends upon what your needs are. And they're getting better and better. So many of these, there are so many that have come out of the woodwork in this last bit of time. Some of them are just designed for what we are asking for during this COVID-19 problem. They are just patient facing. They are patient to provider. You could not use that system later on if you decide, yes, I like this teledentistry programming and I want to engage it into my practice later on, and I'm going to send my hygienist out to a nursing home. It's not for that. It's not for long-term storage, or it doesn't have those task connections back and forth to, did the dentist finish the evaluation? Do I need to do anything else? Some of them are just video conferencing, which is basically taking a phone call and making it a video conference. So you're going to need to decide what your final goals are and then see which one works best for you. Whether you're choosing a small program or a large program, just run through them and see which one fits you the best and fits your needs. So where are we going to be able to use teledentistry post-COVID? I see it most with a medical dental integration. Again, you can expand your practice to a satellite, but that satellite might be in a hospital or an ER or an urgent care. You could put a hygienist in one of those situations, in one of those facilities, and she could be helping to screen for dental problems and taking care of emergent needs, such as applying SDF and ITR, or just a fluoride if they're in there for root sensitivity. So I do think there's a lot, even currently during this COVID virus issue, we can be in that hospital ER urgent care situation. But in the future, I can also see us working in a pediatrician's office, primary care. We're going to see a lot more medical dental integration, everybody working with each other. If the patients are still experiencing that PTSD, and we're opening up partially, if we're all opening up with a 50% staff, well, maybe you send the other 50% of your staff into one of these settings. I think you could easily do it with a home health care team. Those that are going to individual homes and taking care of patients, we could be offering our dentistry. We're not compromising social distancing that much. Yes, we are with that person, but there aren't 20 people in the room with us. And you can simply just do it for screening, to take a camera in and tell patients, this is an issue, you do need to see a dentist. No, that issue doesn't need a dentist. So you're not even providing any treatment, you're just providing screening and hopefully a connection for that patient to your home. You're going to offer them a dental home that they will have to visit. I'd like to give you some information on how to use an intraoral camera in the future. If we're not using the camera to do our teledentistry, we're going to be doing more with our intraoral camera. It's not always easy. So I'm going to show you a little. Is my video not working?
Cindy, it's not playing the volume.
I can see that. I'll skip that. So I had so much information in my head when I set up this teledentistry program that I had to put it somewhere. So I got together with Patty DeGangi and we put together a teledentistry workbook, and it's called Teledentistry Pathway to Prosperity. But it's critical decision workbook. It helps you make the critical decisions. It doesn't tell you how to make them. It walks you through the decision-making process of setting up a teledentistry program. So of course I can only give you a peek of what's into it in this time frame. And also, since we don't seem to be having good connections, I promise you we ran all these videos beforehand. But anyway, this is how I envision the workbook looking. It's a work in progress. I see you grabbing it and taking it when you're running off to the bank to see if you need to get a loan, a reminder to get your national provider number. And there are areas in there for you to write your own notes, to direct your own program and your own journey. So it doesn't tell you how to do it. It just helps you walk your way through it. So let me go through some of what some of the questions are that we asked you and some of the ideas that we had to think about. With your setup, you need to decide what patients you're going to serve. And then you need to decide the people I need to see, are they unique in this area? Who is my competition? Is there someone else already doing that in this area? Do I need to have a profit or a non-profit situation? Where's my location going to be? Am I going to build? Am I going to lease? Am I going to buy? Do I need a contractor? Decide on your business model. Am I going to own it? Am I going to have an employer? Am I You're going to try to have a collaborative contract. And then what services am I going to offer to these people? You need to reflect on what type of investment you need to have. Will there be startup costs? Do I need to apply for grants? Do I need a bank loan? Do I need a partner? Are there certain government bonds that are available for this? There's a lot. And do I need to do any marketing? When do I think I will be solvent? Do I need to quit my day job? Will I do the billing? Do I need an accountant? Am I going to be fee for service? Am I going to accept Medicaid? Or am I just going to take direct reimbursement? Or am I going to run it through a dental office, be a partner with the dentist, and let all the billing be done there or through another type of institution? Think about relationships that you need to get established. Do you need to have contract agreements if you're going to be collaborating with a dentist? Do you need to have a contract with a facility if you're going to be doing school-based or at a nursing home? Run through your operating procedures with the nursing home, with their administration, with their management staff. Will you need to hire outside support? Do you need to get an IT specialist? Obviously, I need to get one today.
Hey, Cindy, I'm sorry,
Yes.
you're breaking up again.
Okay.
I don't know if anything's changed on your end, but it's just choppy.
I thought I was hearing that. I don't see that anything's changed. I'm not getting any notification that I have unstable internet or anything.
Much better actually right now. So whatever you're doing now, keep it up.
Hey, I sat up straight is what I did.
There you go. You must have attended yesterday's ergonomics course.
Yes.
Carry on.
All right, let me go back just a little bit. But we need to think about more than just doing cleaning, exam, fluoride, all the normal things that we're used to doing in a traditional office. This is a whole new innovative way setting. So do things differently. It can be a different type of profit center for you. Hygienists are allowed to do diabetes testing. You can take that out to the patients to do that. There are a lot of risk assessments regarding caries. You can incorporate the Canberra risk assessment into your protocol. There are microbial testing machines that you can test the amount of microbes to determine that risk for developing caries. You can be doing oral cancer screenings. There are a lot of products out there to help you with this. And all of these are ADHA approved codes. Not all of them are paid codes, but you need to investigate that. All of this can be more profitable. If it takes you longer to get out to the patient, then you need to be offering more services out there to them. As far as additional procedures, we can apply SDF, as I was saying. We can apply fluoride varnish. We can apply an ITR, which is the same as an ATR, basically, two different names for different areas of the country. I don't know if you all are familiar with PerioProtect, but they're trays with a periodontal medicament in them. I would be doing this immediately with all my patients that have been on a 2 or 3 month recare and I'm not being able to treat them now. This is a way to stabilize them by using that medicament that goes into these trays. It has a peripheral seal to it, and it can actually deliver the product up to 9 millimeters underneath into the pocket. So to me, this is how I would be stabilizing my periodontal patients right now. When it comes to choosing the equipment, if you're thinking about taking this endeavor on, the equipment that you choose depends upon the services that you're going to be providing. So you need to decide your services first before you go out and make your equipment purchases. If you are just doing screenings, you're going to need the bare minimum. And I don't know, at this point, I might even reconsider that air water syringe if it's really even needed for screening and referral. If you're going to be offering preventative services, you might be going in and out of a facility or a number of facilities throughout the day. You're going to be putting your equipment into the back of your van or your SUV or whatever. That's considered portable equipment. You don't really want anything over about 50 pounds if that is what you're going to be doing. And you need to decide, am I going to be taking x-rays or am I not going to be taking x-rays? If you think that you might have a dentist that's going to work with you, then you would be able to offer restorative services on site also, possibly. If that's the case, then you might want mobile equipment. Mobile means it stays in a facility, doesn't go in and out of the car, so it weighs a little bit more, but it's also a little more substantial. Patients feel a little more comfortable in a more stable chair, things like that. You don't have to use mobile equipment for restorative, it just works a little better. So all I'm saying is decide your services before you choose your equipment. There is also a mobile dentistry cart. If you're going into a medical office and you want to look a little more official and a little more medical, you might not want to be hauling all of the suitcases in and out. You want to look a little more professional. There are also mobile vans that move around from location to location. So there's a lot of ways to use teledentistry in this manner. But I will tell you, whatever you're thinking, think bigger, because it grows fast. You don't want to be selling equipment because you underestimated the services that you were going to be offering. And I am not, in no way trying to tell you that this is an easy way to do dentistry. Give yourself some time. You will figure it out what works best for you. We are definitely going to have a change in PEs. We all know this, right? That has nothing to do with whether we're going to be mobile or portable. We're going to have a hard time dealing with aerosols in a mobile or portable setting, but I can assure you the manufacturers are thinking about that. They're looking into antimicrobial powder coatings. They're looking into antimicrobial fabrics for the patient chair and stools. They're looking into the suction, extraoral suction pieces of equipment. So we will get there. As soon as the CDC tells us where to go, the manufacturers are waiting right there to find out what the regulations are also. We might be looking at exams a little different. I don't think it's going to be a pop-in, let's see what's happening with sweet little Susie here. There's even suggestions that the dentist does no examination during the day. The dental hygienist does all teledentistry examinations, even while they're in the same building, so that the doctor doesn't have to take off their PPEs in between patients and then dress up again. And then at the end, schedule the dentist from 4 to 5 o'clock with no patients, and all he does is reevaluate, do all the evaluations at that time. You tell the patient the doctor will get back with you. Of course, if you see something that absolutely needs the doctor, you know, a lesion or something, then you just can automatically schedule the patient to come in. So it doesn't have to be, it won't be cut and dry. There's also talk of having just hygiene days and restorative days to reduce the amount of aerosol burden. And if that's the case, then you can do teledentistry evaluations, and the dentist can be sitting in his office doing the exams that way. We'll see what happens. I do believe it's here to stay. I believe teledentistry is here. I don't think once the genie's been let out of the bottle, I don't think we're going to go back, or at least not completely back. So that's why I think we need to find ways to incorporate it into our new protocols. We have the support of the government. This is a reform booklet that was written in November of 2019. And it's reforming America's healthcare system through choice and competition. This is with the Department of Treasury, Health and Human Services, Trade Commission, and Department of Labor. And the report said Their recommendations to improve healthcare, I know there's a lot of words here, but they're all very important, was to allow all healthcare providers to practice to the top of their license, utilizing their full skill set. They also recommended that the state should consider allowing non-dentist providers to be directly reimbursed. That falls into the dental therapists. And that we should eliminate requirements for rigid collaborative practice and supervision agreements. The state should consider adopting interstate compacts and model laws that improve license portability. To me, that says national licensure. They are recommending national licensure. And that the state should evaluate emerging healthcare occupations such as dental therapy. So the government is recommending that we move forward with this. I have just been assigned to the ADHA's Return to Work Task Force. And I know that did I say ADA? If I didn't, I meant ADHA. But I do know that ADA is doing the same thing. So we are all trying to get back to work, whatever work looks like. We're all going to redescribe what work looks like. If you'd like to contribute to this or get your voice heard, ADHA has an exclusive email just for this, and that's ADHA COVID Task Force at adha.net. Be happy to listen to what y'all have to say and your recommendations. So I've always said it's time to disrupt with teledentistry, but right now we need to pivot also, which is interesting because that's the exact word that Jody said when we were having electronic problems. And I feel, as Maya Angelou said, you do the best until you know better. And then when you know better, you do better. I think this COVID virus timeframe is going to teach us how to do better. This is my granddaughter.
If you can believe in it, if you can dream, and if you can dream it, and if you work hard for it, anything can be possible.
So I believe in what Claire says. I think our adventure is just beginning. Thank you all for listening to me and helping me get through this electronic issue. I'm so sorry. It's very embarrassing to do a technology program and to have technological problems. So thank you so much for bearing with me. And here's my contact information if you have any questions or you need to get a hold of me. Thank you so much.
Thank you, Cindy. Before we head into Q&A, just a couple questions. First of all, don't apologize. It happens. And no need to be embarrassed. Thank you everybody for staying with us. You were very patient and kind. So thank you. I think we all need a little extra patience in these days, if anything has taught us the last few weeks. That is one of them. All right, so as we get into the Q&A, just a reminder that the CE link will be provided in the chat. And we have just put up a new slide here that just outlines a reminder for the AGD code that you're getting 2 CE credits, reminder that it's available in the chat, and that the link will also be included in your follow-up email, which will be sent, I said early tomorrow, but it might be later today, I apologize. And then after you're completing the survey, you will receive your CE verification in an email. Some people have said that it is going to spam. So if you don't see it right away, please check your spam folder. All right, so let's dig into the Q&A. I see that, sorry, before we do the Q&A, I see that some people are still asking if they're gonna receive a recording. Yes, and that's exactly what the screen says now. So hopefully everybody can see that. All right, Q&A. Somebody actually asked about, if the program that you're doing, if you're looking for people in other states, or how to get them connected to organizations that are doing teledentistry, or how to get started.
At this point, it's everybody for themselves, I would say. That's not exactly true. There are some companies such as Floss Bar that is one of the companies that goes into corporate pop-up situations where they will go into Apple and do teledentistry in that area. How that's going to look with this aerosol situation at this point, I don't know. I don't know how that's going to change just yet until we get the CDC regulations to see when they're going to come back up. I know that Floss Bar has also pivoted at this time, and they are offering COVID-19 testing and also hearing and eye exams and putting dental on the back burner for right now.
So somebody had a question about encrypted email. They prefer to use their work email to send patient information and to have their patients email them back. Is that acceptable, or is there still security issues?
As long as it's encrypted, it is okay at this point. The problem, and what the all-in-one systems have tried to solve, the problem they've tried to solve, is that all of your information is in different places. It's hard to transfer records. It takes more time, basically, to load, upload, download, get it into the practice management system. So yes, it's okay as long as it's not regular email, but as long as it is encrypted.
Thank you. Before the next question, many people are saying that the link is not working. You need to copy and paste it. We cannot provide hyperlinks in the chat, so please copy and paste the CE survey link. Thank you. All right, next question. What are your thoughts on using teledentistry for ortho follow-up, where you can digitally scan and make aligners and follow-up cases with teledentistry?
There's a lot of complications right now, or miscommunications about that. There are some companies that are doing that and trying to do it cross over state lines. If that is what you're referring to, there are a lot of violations, state violations for that. But if you're referring to just doing it in your own practice with your patients, one doctor diagnosing within the same state, I think you could utilize it for that. Again, state practice acts.
Okay. Does Medicaid only reimburse for teledentistry for patients with COVID symptoms at this time? Like, is it only because of the circumstances right now?
They have relaxed it a lot across the board, across the country. But again, I hate to keep saying it, but it is so different for every single state. So that's why I would say go to that connected center. I can't even think of it anymore. Connected center. They will be able to tell you much more information for each state.
Right. When we provide the recording, they can go back to that slide as well.
I was going to say I could go back and find it, but if they want to email me, I will get it for them exactly.
Okay, great. Can you provide any details regarding telehealth certification, courses, time commitment, cost?
The telehealth course that I took was through Thomas Jefferson University. You have to apply to the university as if you're a regular student. It's rather complicated. And it was about, I don't know, a 6 or 8 week course that I took. I believe there will be some, if you stay in connection with me, I believe there will be some teledentistry certification coming in the future, in the next few months.
All right. Sid, just so you know, your calculator is showing. All right. I think that you have answered this one a few times, but can hygienists start teledentistry anywhere we live? Like in California, hygienists are independently working, but in Georgia, there's still general supervision.
Right, vast change from what California can do to what Georgia can do. Again, state practice acts. California still has to have some collaboration with the dentist, where Georgia is brand new and they can do some limited treatments, some limited services.
All right. Is this something that can be used if the dentist cannot come into the hygiene room but are in the building? Can a D120 visit apply?
That's what I'm thinking will be the answer for during COVID, to because it's going to take so long for a dentist to don and doff their PPEs. But again, you must read your state practice acts, because as I stated, some of them do specifically say that there is a geographic restrictions. So they want to make sure you're not doing that. They want you to be in 2 different locations. There is also, I know for sure, Texas, their definition of evaluation is that it has the word tactile in it. So you cannot do a teledentistry exam in Texas legally. I mean, it's not considered legal. So again, it's the state practice acts and your rules and regulations that will determine if you can do that.
All right, and somebody helped us with the name. It's the Center for Connected Health Policy.
Thank you.
All right, and then somebody in your home state is asking where they can get a copy of the Dental Practice Act for Colorado.
You can go to the Colorado Dental Hygiene Association website. It's right on there, both the regulations and the practice acts. But that one I happen to know quite well. You can contact me too, but I will eventually tell you to go to that.
All right, that concludes our questions for the day. Cindy, thank you so much again. We appreciate having you. We're thankful to have your presentation, and I think everybody's comments would definitely say that they learned a lot today. So thank you so much. Thank you all for your patience. Have an excellent and healthy weekend. Take care.
Thank you.